All right, so the coronavirus pandemic is really ravaging South Africa as cases there continue to surge. There's more than 300,000 confirmed infections, while nearly 4,500 people have died there. The government is ramping up its response by imposing curfews and banning alcohol sales. South Africa's president warns of the gravest crisis in the history of our democracy.
But now, the surge in infections that we had been advised by our medical experts would come has now arrived. The storm is upon us. More than 250,000 South Africans have been infected with coronavirus, and we know that many more infections have gone undetected.
Many hospitals are being forced to turn away patients because of overcrowding and lack of healthcare workers, and some South Africans say they are struggling to get tested and treated.
This is terrible. Sick people are getting sicker. Some are dying on their legs, It's hurting. It's hurting really.
I'm very, very worried. I think everyone should. It's something that is challenging a human life. It's something that can kill, that has a potential to kill maybe half of the population in the world.
For more on this, let's bring in CBS News correspondent Debora Patta. She's joining us now from Johannesburg. Debora, this is so heartbreaking. I had been planning, my family and I, to come back to South Africa in September near Durban for another safari, and now we've put that on hold because of the cases not just here in the United States, but also in South Africa. So what is the latest there as cases continue to surge?
Well, certainly, I don't think you and your family will be traveling here in September because this country is only expected to peak in September. It was really hoped that the coronavirus would tread lightly on the African continent. It was slow to arrive here, but now it's here with a vengeance. And as you reported, nearly half of all cases on the African continent are here in South Africa, over 300,000, with nearly 4,500 people having died from the virus. And South Africa's President Cyril Ramaphosa warning there in that soundbite that you played that the COVID storm is engulfing this country, and it certainly is stretching the resolve and the resources of South Africa to their absolute limits. The cases are being seen multiplying across the country with a kind of ruthless efficiency. Now, South Africa went into a very hard lockdown at the end of March when the first infections arrived in this country, and that helped to some extent prevent the virus from spreading. But as restrictions have been loosened, and they've had to because of the huge economic impact of the lockdown, we've seen that virus spreading across the country and those cases rising, and different provinces are dealing with it differently because not everybody has the same resources. It was hoped that that early lockdown would actually help the health systems, give them time to prepare for this pandemic. In some areas that has happened, but in the poorer parts of the country, it's unlikely that that has happened at all.
Debora, can you dig a little bit more into that? Because as we've learned here in this country, the concern over the virus is directly linked to the healthcare system's capacity to deal with the influx of new patients. What is happening in South Africa? We're hearing, horrible stories about hospitals having to turn people away because they simply don't have a place for them.
It really depends on your geography, Anne-Marie, and I think that's a very important question. President Cyril Ramaphosa of South Africa spoke of this COVID storm. We're all in the same storm, but we have different boats battling that storm. Some people have fancy cruise liners. So, for example, here in Gauteng, the richest province in the country, the economic hub of South Africa, hospitals by and large are better resourced. And there's still a shortage. People are concerned about a lack of oxygen, a shortage of protective gear and other equipment needed to fight this pandemic. And as it gets worse, that's going to become more of a problem. But there are also a lot more hospitals here here so they can shed the load. So you haven't seen people being turned away from hospitals in Gauteng. But then you go to poorer parts of the country like the Eastern Cape, the poorest province in South Africa, and experts were always warning that if the coronavirus hit this continent, it would decimate already fragile health systems. Well, that's what you're seeing in a place like the Eastern Cape. The Eastern Cape has been beleaguered for many years. It's come through over a decade of corruption and mismanagement under a previous administration, and what the coronavirus is really doing is exposing the rot that has been there all along. So at a hospital like Livingston Hospital in Port Elizabeth, the capital there, what you are seeing is waste, medical waste overflowing, rats feeding on that medical waste, a huge shortage of equipment, people making makeshift protective gear, even things like washing machines are broken down, so staff are unable to wash sheets and provide clean sheets, and of course a huge shortage of staff and having to turn people away and no other places for those people to go to. Gravediggers have been told to prepare hundreds, dozens of graves because the number of deaths is rising steadily in that particular province, people dying lonely deaths in hospitals. We've seen that all around the world, and then being buried quietly and alone, families not being allowed to go to the grave sites. And crippling that as well is the twin pandemic of hunger in this country. A recent survey showed that in 1 month, nearly 50% of South Africans ran out of food. We are seeing desperate food shortages and hunger and malnutrition in places that we've never seen it before in South Africa. It's very worrying indeed, Anne-Marie.
You know, Debora, it's so heartbreaking to hear you describe those conditions. And I guess my one hope is that, as you know, the rest of the world, you know, in years past, the United States led the world in combating infectious diseases. There is no other country right now who is taking their lead from the United States, with perhaps the exception of Brazil. I wonder what it is like at the government level in South Africa in terms of figuring out a way to combat this, the spread of COVID-19, both at the federal level and at the local level. Is there a sense that there needs to be something done and the leaders are just trying to figure that out? Because you've seen that happen in France, you've seen Italy do that. The United States has not yet caught up to that notion. I wonder what it's like in South Africa.
It's a good question, Vlad. Look, we have a president who is very concerned about this country, Cyril Ramaphosa, in this country, and it is mandatory to wear a mask. You get fined. You can even go to jail for not wearing a mask. You cannot enter any public place without a mask. You cannot be outside. You cannot run. You cannot jog. You cannot do exercise. You cannot go into any public transport if you are not wearing a mask, and there is hand sanitizer everywhere you go. So just on that basic level, the sort of 3 pillars, social distancing, mask wearing, and hand sanitization is constantly being drummed into South Africans. It's not being practiced everywhere because simply in poorer areas where people are on top of each other, it is very, very difficult to not only police that, but to ensure that it actually happens. But certainly there is a concerted effort. This country's also learned lessons from other countries. So one of the peculiar anomalies about South Africa is, despite having a high number of infections, we have a relatively low death toll compared to global statistics. In this country, there are only just under 4,500 people who have died from COVID. Now, some of the reason for that could be underreporting, and yes, there is concern about that. I spoke to the head of trauma in South Africa's main hospital, and she said, yes, there is underreporting of deaths, possibly, but there's only so many dead bodies that you can hide. We've learned in this country from other countries about how to treat critically ill patients. Oxygen is the preferred method in this country before ventilation, and that is helping a lot of critically ill patients to survive this disease. There is also interest in the BCG vaccine, which is given, it's mandatory in this country. It's given to children to prevent TB, another big killer in South Africa, coupled with HIV/AIDS. And there are studies being done around the globe as to the fact that possibly this vaccine provides a relative amount of immunity. It could at least lessen the effects of the disease if you do manage to contract COVID-19. So these things are helping to hopefully contribute. It's still, the jury's still out. It's still early on. The peak is only, as I said, in September. But certainly they are having some kind of effect, and there is leadership. It doesn't always trickle to the ground in the poorer areas, but there is leadership in this country, and certainly the scientists are being heavily respected in South Africa in terms of advising this government on how to manage this disease. Vlad?
That is welcome news, Deborah, because here in this country, it's a patchwork at best. As you know, we've had governors repealing local mandates for people to wear masks in certain states. The understanding that in South Africa, what you call the three pillars of social distancing, masks, and hand sanitizer are being drummed into the population there is really important. Debora Patta reporting on this really important story. Deborah, so glad to have you on the air. We don't get to talk to you as often as we should, and you're really providing some important context and information and reporting for us. We really appreciate it.